My name is Bobby Hudson. I had a stroke November 23rd, 1999. I was admitted to the hospital. I remained in the hospital for 2.5 months. And one of my friends referred me to Florida Hospital for my follow-up care. I majored in physical education and I've been physically active all my life. Even at 65 years old, I was riding my bicycle, going out playing with my grandchildren, going to the beach, taking a walk, driving myself around. And I could just imagine as I laid in bed, not being able to move, that I would never be able to do these things. I had therapy every day, different hours of the day. I did different things. I had occupational therapy as well as physical therapy. And I learned to talk all over again because I had problems talking. I was paralyzed down the entire right side of my body. I couldn't raise my arm and I couldn't raise my leg, and I was having trouble walking. They started me out in a wheelchair, walking in front of the wheelchair, and a therapist would walk behind me and push the wheelchair, and one would be on the side of me to guide me. And I did this at least 3 times a day, morning, afternoon, and evening. And in between time, I had speech therapy where I had to learn to talk, saying words, reading sentences, pronouncing different words, and seeing how long it would take me to say the words and the sentences. My progress was very well, and the nurses and doctors all encouraged me every day, and they told me how proud they were of me because I worked so hard, and I was just determined to get myself back up on my feet and try to walk and be as independent as I could and do the things that I once did every day before then. And the nurses and doctors, they were just superb. They all gave me 100% of the best treatment that you could ever want to get, really encouraging me that I was doing well. They encouraged me to take my medicine and continue my therapy even after I left the hospital. And they stressed to me what they wanted me to work on at home. They built me some different frames, and I would work at home with weights as much as I could. My family supported me, and my children helped me with some of the exercises. I was stressing to my family that I didn't want to have a wheelchair because I was determined I was gonna walk. I'm gonna walk up and down my own hallway. I'm going in the kitchen, fix myself a cup of tea, and I'm gonna sit on my couch. My family was all standing around. They said, well, we're just gonna stand here. We're gonna be here with you to see if you can do these things. So the first day, I had some difficulties. I had to back off. But as the time went on, I progressively got stronger and able to do those things on my own. My fondest part would be in the evenings after we did all of the exercise. I would go up and talk to the nurses. I would get myself up, and when they would see me, I would be in the wheelchair trying to roll the wheelchair on my own. It was exercise to this right arm to be able to roll the wheelchair and to use my leg pushing the wheelchair. And they would see me and they'd say, there she goes, there she comes. And I'd say, yep, I'm coming out here to see what you all are doing. So I would go out in the sitting room and we would all sit out in the afternoon and watch some television. But my fondest memories were just the staff and how good they were, and nice they were to me. And they weren't only nice to me, they were nice to all of the patients there. And they took a lot of time with each and every one of us. Because of the care that I received, I would refer anyone that I know who has had a stroke or need therapeutic training to go to Peninsula Rehabilitation Center because they're the best in this area. I really enjoyed it. The staff was fantastic. They worked diligently with me, intensely with me. They were all very courteous and patient at any time I ever needed anything. And I really want to thank all of them.